first thing you want to do is just test range of motion. So you're going to take them from extension to flexion, back to extension again. Things you want to test are full pronation like this, and you want to test full supination like that. So then the next thing you want to do is you want to palpate along the medial aspect of the elbow here. So this is the medial epicondyle here, and the sublime tubercle is going to be that here. So you want to palpate along the origin of the ligament there, and as you palpate down the ligament into the sublime tubercle, which is going to be right there, and they may experience pain or discomfort along the course of the ligament there. Next thing you want to do is a valgus stress test. What you want to do is you want to support the arm here and support the elbow on your knee, and that allows you to take them through range of motion while applying a valgus stress across this ligament. So you can come here and go back and forth there while supporting the arm. And sometimes, say I want you to wince like you're in pain. Yeah, there you go. You can tell that he has an insufficient ligament. All right, so keep looking at this. Okay, so you take him through the range of motion like that, and again, you're just trying to stress this ligament here to see if there's any laxity or see if there's any degree by stabilizing it on your knee and going back and forth. The next thing you want to do is test the ulnar nerve. So the ulnar nerve lives posterior to the medial epicondyle, so you want to put your finger on there, and as you take them through flexion and extension, sometimes you'll feel that snap over the top of the medial epicondyle. That means they have a hypermobile nerve, so you'll take them through that and go back and forth there. You can also palpate along the ulnar nerve to see if they have a positive Tinel sign. Lastly, you want to look at the medial aspect of the elbow here. This is where the flexor pronator mass is going to go into its forearm musculature. You want to palpate alongside there, which is going to be more anterior than your ligament, which runs down here. You're going to be palpating along the top of those muscles there. And ways to test that is to resist finger flexion. So resist me right here, Sam, and you can resist that there. And you can also have them flex their wrist, so flex your wrist now and resist that there. And sometimes that will reproduce the pain there. You can also do resisted supination, so go the opposite way, like you're gonna go palms up for me there, and see if that reproduces some of their pain there. And you can come across here and go down with your palm now. Good, so you can do both of those. Then you wanna look at the palmaris longus here. So make sure we're showing this there, but you'll take your thumb and your pinky and touch it together there. And this is a good example of what the palmaris longus looks like. And sometimes you can have them flex their wrist a little bit, and that'll accentuate it anymore. This right here is something that we'll take for a graft many times. They're little small focal incisions, but this here is the palmaris longus tendon, and adjacent to that is going to be the FCR tendon, more radial. Okay, you can relax there. So then posteriorly, what you want to look at is you want to look at the triceps insertion site here. So the triceps is going to come down and insert along here. Sometimes if they have a stress fracture in their olecranon, they'll have tenderness as you palpate along the olecranon there. They may have pain in the triceps insertion site. And if you take your arm and you extend against me, Sam, there, so extend up against me, sometimes that'll reproduce pain into that insertion site. Other things you want to look for posteriorly, again, the arm bar test. This is a way you just take the arm and you kind of snap it into extension. So you want to make sure they're relaxed, and then you snap it into extension. And if they have a true olecranon stress fracture back there, then they'll have pain in the posterior aspect of their elbow as you force that into extension. The other thing you can do is a forced arm extension, where again you support your elbow there and you're resisting against full extension there to see if that reproduces any pain as you bring them into full extension. Other things to look for here is on the lateral aspect of the elbow. We're looking at the lateral epicondyle origin here. So this is the lateral aspect of the elbow here. And many times if they have tennis elbow or radial tunnel syndrome, they'll have tenderness here, but they'll also have tenderness as you palpate down into the radial tunnel there. Test for that is to resist long finger extension. So extend your fingers there, resist me there. And sometimes they'll have pain and discomfort as you go there, and then extend your wrist back. And same thing as you go across there, they may have pain there. Also here you can test for crepitus. So if you palpate along the radial tunnel or the radial neck region here, and you take them through range of motion, pronation and supination, and you go from flexion and extension, you may be able to feel a band of tissue pop up and down. That's a plica. Or you may feel crepitus, which is going to be on the anterior aspect of the capitellum there. So you may feel some crunchiness across there. Lastly, on the anterior aspect of the elbow here, you can see here the biceps tendon here. You want to see the biceps as it inserts here. And one thing you want to do is go from lateral to medial and hook against it. So you want to support the wrist and you want to hook against it. And then Sam, just give me a little flexion there. And then as you flex against it, you should be able to hook that biceps and feel that it's intact. And lastly, I'll kind of show from this lateral side one more time some of the lateral anatomy here. So lateral epicondylar region, radial tunnel there. You want to palpate along that area there, and you want to feel for crepitus or crunchiness as you pronate and supinate, and you may be able to feel a plica jump up across there as you go across that area there. Okay, that's it.